I'm Bailey Gallagher, and today I'll be presenting on the effectiveness of physical therapy in treating full-thickness rotator cuff tears. So just a quick introduction on the rotator cuff. Its main job is to stabilize that shoulder joint, preventing any kind of dislocation or subluxation of that humerus. Tears are pretty prevalent in our society, unfortunately. About 10% of patients over 60 have suffered from rotator cuff tears, whether it be from work or sports or recreational activity. And then in terms of treatment, you have surgical and non-surgical. Less than 5% actually opt for the surgical procedure. The surgery has a failure rate of somewhere between 25 to 90%, which is pretty significant, especially when you consider that the floor there is 25%. And you also have to consider the possible side effects or risks of infection, damaging nervous tissue, muscle tissue, and even the possibility that you might need a further surgery down the road to repair any damage that occurs. So the overall purpose of this study was really to see if physical therapy is effective as an alternative treatment method in comparison to surgery for rotator cuff tears. So in this study, they're looking at outcomes on pain, function, general quality of life, and daily activities, including that in sports, the workplace, or even recreational activities, and especially range of motion in order to get these patients back to performing these activities. They also wanted to see if physical therapy is effective in the short term. Are these results effective over time, or do these patients have to opt for surgery sometime down the road, or even end up back in the clinic for follow-up physical therapy in a year or two? So just some background information on the participants in this study. So it started out with 452 patients. The average patient age was 62, but it fell anywhere from ages 31 to 90. And the number of patients decreased as the study progressed along, as patients decided that they were either healed or the PT decided that they were healed, or if they withdrew from the study because they opted for surgery. To qualify for the study, the patients need to provide a documented MRI of their full thickness tear. They needed to complete an initial evaluation with the PT or the PTA, and they could also not have any prior injury history to that shoulder area that might skew the data. The location of the study, it took place in a variety of different clinics throughout the United States. Didn't really get into specifics as to where exactly these clinics were. It just said throughout the country. And if you take a look on the chart to the right, you'll see that 70% of the patients in this study suffered from just a supraspinatus tear. So that was the primary diagnosis in this study. But then 21% suffered from supraspinatus and infraspinatus. So those two rotator cuff tendons are what made up the majority of the diagnosis in this study. So here we have the method of what actually took place in this study. So the 452 participants took place in a physical therapy regimen for at least 6 weeks. Once they reached that 6-week barrier, they kind of reevaluated the situation to see where they were. If they felt that they were responding well to therapy, they could go another 6 weeks. If they felt that they were healed and ready to get back to their daily lives, daily work, sports, whatever it may be, they could go ahead and end treatment there. Or if they felt that they weren't responding well to the therapy, they could opt out and get the surgery for the rotator cuff. They weren't at the clinic very often. They only averaged about 1 visit per week, so primarily the exercises were taking place at home. In terms of the PT regimen, modalities, the focus was heat and ice to try to alleviate some of that swelling and that inflammation in the joint and decrease pain, so you could work on improving that range of motion ultimately. And then range of motion activities, strengthening and stretching, they focused on the scapular area and the cuff area, because ultimately they want to regain that stability that the rotator cuff provided before the tear. So they're working to build up some strength in that area. And then they also did some mobilizations to try to also promote some decrease in pain and improvement in range of motion. And as you can see here, pictures, just a couple different exercises that might be seen in this therapy treatment. You have external rotation with the TheraBand at the top right, and then scapular retraction at the bottom with the TheraBand. So here's some of the data that was gathered during this study. In terms of range of motion, that was measured with an active range of motion with a goniometer. As you can see at the top right, here's some of the different Shoulder movements that were recorded, you had flexion, extension, abduction, adduction, internal and external rotation. There was also some patient self-reported questionnaires and scales, and all these scales range from 0 to 100 in terms of grading, and they assess different levels of function, quality of life, and then just some general limitations. As you can see at the bottom right here, I provide an example of an ASCS questionnaire. And here's just some sample ideas of what the patients might be looking at here. Some difficulty experienced with getting changed, showering, putting on a coat, combing the hair, just basic activities that you might take for granted when you're actually healthy. And with this in particular scale, it splits it up 50 points related to pain and then 50 go towards the ADLs. They also took a look at the success and failure rates of therapy. So in this study, they went up to 2 years down the road. They were still in contact with these participants to see how they held up and if they ended up opting for surgery after PT treatment. So they wanted to get an idea of what percentage of patients did not have to opt for surgery in the long run at the 2-year mark. So here we have the results of the study. In terms of improvements in range of motion, patients seem to improve in all planes of motion. So we saw the most improvement in forward elevation or shoulder flexion, as well as abduction. And there was some gradual improvement in internal and external rotation, but we know there's ultimately less motion in those planes to begin with. In terms of the patient reported outcomes, there was also significant improvement in each one of those. We saw the SANE scale improve by an average of 23.67 points, the work questionnaire improved 22.5, and the ASCS questionnaire improved an average of 29.2. And all these improvements came within 12 weeks. In terms of success and failure rates, at the 2-year mark, 75% of the patients had not opted for surgery, so it seemed that physical therapy was pretty effective in treating about 3/4 of these participants. And of the 25% that did opt for surgery, 15% of that population opted to do so within the first 6 weeks. So it was kind of a given from the beginning with these patients that the tears were too significant and that they wouldn't respond well to PT. So just some closing thoughts, things that I picked up on with this study. What I thought could have been done better, I thought there was a risk for selection bias. I thought the participants, some might have had preference towards the PT and had more compliance with their exercises, especially at home, and some might have just wanted to have the surgery and get it out of the way and not do the work that's associated and required in physical therapy. I also felt that there was too much reliance on subjective data in terms of those patient self-reported outcomes. They're awesome to see what the patients are going through and what they're thinking, but it's kind of hard to get concrete measurements with such subjective material. So I would like to see more objective recordings in this study. What stood out, I enjoyed that there was such a significant amount of participants and that it went so long that you could truly appreciate the lengthy outcome and benefit of physical therapy over time. Ultimately, I feel that all patients that are suffering from rotator cuff tear should definitely consider physical therapy before turning to the surgical alternative. So I hope you guys enjoyed this article and this journal review and took something away from it the way I did. Thank you.